Hello everyone, hi, I'm Jewel. Welcome to my channel. Today's topic is preventing diabetic kidney disease, 10 answers to 10 questions. This information is coming from the National Kidney Foundation. Diabetic kidney disease is a decrease in kidney function that occurs in some people who have diabetes. It means that your kidneys are not doing their job as well as they once did to remove waste products and excess fluid from your body. These wastes can build up in your body and cause damage to other organs. What causes it? Number one, the cause of diabetic kidney disease are complex and most likely related to many factors. Some experts feel that changes in the circulation of blood within the filtering apparatus of the kidneys glomerulus may play an important role. Number two, are some people more likely to get diabetic kidney disease? Yes. The following risk factors have been linked to increased risk of developing this disease: high blood pressure, poor glucose sugar control, inherited tendency, and diet. Number three, I have diabetes. How do I know if my kidneys are affected? In the early stages, there may be no symptoms. As kidney function decreases further, toxic waste builds up, and patients often feel sick to their stomachs and throw up, lose their appetites, and have hiccups and gain weight due to fluid retention. If left untreated, patients can develop heart failure and fluid in the lungs. Number four, are these tests that can be done? Are there tests, that can be done to tell if I have kidney disease? Yes. The diagnosis is based on the presence of abnormal amounts of protein in the urine. The wide variety of tests can be done to tell if a person has kidney disease. The most widely used are serum creatinine and BUN, blood urea nitrogen. These are not very sensitive tests because they do not begin to change until the patient develops more severe disease. Other more sensitive tests are creatinine clearance, glomerular filtration rate, and urine albumin. In patients with type 1 juvenile onset or insulin-dependent diabetes, a diagnosis of early kidney disease can be based on the presence of a very small amount of protein in the urine, microalbuminuria. Special methods are needed to measure these small amounts of protein. When the amount of protein in the urine becomes large enough to be detected by standard tests, the patient is said to have clinical diabetic kidney disease. Number five, how long does it take for kidneys to become affected? Almost all patients with type 1 diabetes develop some evidence of functional change in their kidneys within 2 to 5 years of the diagnosis. About 30 to 40% progress to more serious kidney disease, usually within 10 to 30 years. The course of type 2 onset or non-insulin dependent diabetes is less well defined, but it is believed to follow a similar course, except that it occurs in older age. Number six, what can I do to prevent kidney disease? There is evidence that careful control of glucose sugar helps to prevent kidney disease in people with diabetes. You should follow your doctor's orders carefully regarding diet and medicines to help control your glucose levels. Number seven, if my kidneys are already affected, can I keep them from getting worse? It may be possible to prevent or delay the progression of kidney disease. Since high blood pressure is one of the major factors that predict when diabetes will develop serious kidney disease, it is important to take your high blood pressure pills faithfully if you do have high blood pressure. Your doctor may also recommend that you follow a low protein diet, which reduces the amount of work your kidneys have to do. You should also continue to follow your diabetic diet and take all of your prescribed medicines. Number 8, are there any new treatments that can help me? Yes. Some studies suggest that a group of high blood pressure medicines called ACE inhibitors may help to prevent or delay the progression of diabetic kidney disease. These drugs reduce blood pressure in the body, and they may lower the pressure within the kidney's filtering apparatus, the glomerulus. They also seem to have beneficial effects that are unrelated to changes in blood pressure. Patients who take these medicines may have less protein in their urine. They may want to speak to their doctor to see if these medicines could help you. How many people with diabetic kidney disease develop total kidney failure? Number 9. About 30% of people with type 1 diabetes and about 10 to 40% of the people with type 2 diabetes will eventually develop end-stage kidney failure, requiring treatment to maintain life. Certain population groups, such as African Americans, Hispanic Americans, and American Indians, have a higher risk of developing kidney failure from type 2 diabetes than Caucasian Americans. Number 10. If my kidneys do fail, what can I do? If your kidneys fail, you can receive dialysis treatment, or you may be a candidate for a kidney transplant. 2 types of dialysis are available: hemodialysis and peritoneal dialysis. Your doctor will discuss these treatment options with you. The decision about which treatment is best for you will be based on your medical condition, your lifestyle, and your personal preference. Oh, sorry, guys. My dog was coming in the door. So, guys, this is Preventing Diabetic Kidney Disease, 10 Answers to 10 Questions. And if you found any of this useful information useful, please like, share, and subscribe. I chose this topic because I know someone right now that is going through this process and this disease, and I wanted to inform myself about it, and of course inform you about it also. So that's the reason why I'm talking about this topic today. And like I said, if you found it useful for yourselves or anyone else, please like, share, subscribe. And as always, we're thinking about you, sending you lots of love and care. And please know that you're not going through this alone. And just take care of yourselves, guys. Always be compliant with your doctors, and always stay positive, guys. And I will see you on the next video. Bye.